So this is a tricky one because I don't call it hormonal imbalance. It is a natural transition that happens in a woman's life, really. So we get a gradual decline of estrogen, and in postmenopause, this remains low. And in perimenopause, as we know, there are fluctuations in this hormone, so it's a bit chaotic. But overall, in general, there is a decline in a hormone called estrogen. So rather than calling it hormonal imbalance, I would say this is just a natural process, and we just need to be aware of what happens to the estrogen hormone with this process. So, how it's treated, this answer is again very difficult to, sorry, this question is very difficult to answer because it's very personalized, in my opinion. You can treat it with lots of different, in lots of different ways. For example, we often think about something called MHT or HRT, but that's not the only way to treat menopausal symptoms. And not everybody gets menopausal symptoms, and not everybody is severely affected by them. So it's very much on the individual, on what's happening to them and what is appropriate for them. So, for example, if somebody doesn't have many symptoms and is not bothered too much and has a very healthy lifestyle, they may not need treatment or additional support with medication or supplements, etc. However, if you have somebody who has severe symptoms, who is quite affected by them, and their daily functioning is quite affected by these symptoms, then we would look at, obviously, priority number one is lifestyle, and making sure that the lifestyle issues are addressed first of all, because there's no point adding things to that if the foundation isn't suitable and isn't optimized. But then looking at all the various different options and treatments that we can look at. Now that may be hormonal treatment, but it may also be non-hormonal treatment. So the answer is, how is hormonal imbalance treated? First of all, it's, in my opinion, it's not a hormonal imbalance, it's a natural process. And second, the treatment is very personalized. People get a little bit confused about MHT and HRT. HRT means hormone replacement therapy, and MHT means menopause hormone therapy. So we prefer MHT as a term for treatment when we're using hormonal medication, because as I described, it is a natural process where we drop our estrogen, and we don't view it as a deficiency as such that you need to replace. So hormone replacement therapy suggests that we must replace estrogen for everybody. It's a deficiency, very much like, for example, I'm just going to use an example with thyroid function. So if somebody's hypothyroid, they're lowering in their thyroxine, therefore we need to replace that for them to be able to function. When you drop your estrogen, it is beneficial to replace the estrogen for many reasons, such as bone health, and it could be beneficial for cardiovascular health if it's done at the right time for the right person. But not everybody, we're not suggesting that everybody has to have estrogen replacement. So I like the term MHT because it's looking at hormone therapy from that individual's point of view. Is that appropriate? Is that suitable? And will it help that patient? So the gold standard is very much, again, the answer is personalized. So what's gold standard for you may not be gold standard for somebody else. We often hear about body identical MHT, and you may read about different various types of bioidentical hormone therapy, and that being promoted as the gold standard. Now that there is a reason why that's being promoted as gold standard, because the structure, the chemical structure is identical to our own body's hormones. And as a result of that, the risks are thought to be very low with these. So when you're using it long term, when you're worried about health risks, we tend to opt for these types of hormone treatments with the least amount of risk. But again, as I said, it is very personalized because it may not be the gold standard for that individual, for you, for that person. And we may have to look at various other types of treatments that might be more suitable for various reasons. There may be other medical conditions that we need to look at. There may be side effects with certain body identical hormone treatment, and hormone treatment may not be the right type of treatment for that individual. So it may not be suitable for that person to go on MHT. So gold standard is very much, my answer is always going to be a very personalized approach. Okay, so the question here is about how long does it take to work? And everybody's different. Um, on average, what we say with any hormone treatment, whether that is MHT or contraceptives, we say 3 months. So with our guidelines and with our advice, we think by 3 months, we'll have a fair idea of what's working and what isn't working. And that's why our review appointments are at 3 months. But in saying that, you may notice an improvement fairly quickly within a few days or within a few weeks with specific symptoms. It just depends on how severe the symptoms are and what type of symptoms. So with regards, I've noticed vasomotor symptoms, so that's the hot flushes and night sweats, they tend to respond fairly quickly. So within a couple of weeks, you notice an improvement if you're on the right therapy. There may be other symptoms like psychological and cognitive symptoms, which could take a little bit longer to respond because there often is an underlying issue that we need to look at the psychological elements, and that just takes a little bit longer to improve with time. With regards to, I think you said levels, how long does it take for the levels? Well, as soon as you're using and applying or absorbing the medication. So as long as you're absorbing the medication very quickly, within a few days, you're obviously, your body is absorbing it and it comes into the bloodstream if you're taking systemic MHT. But as I said, the response may take a little bit longer. So I am very much in favor of MHT for those who really find the symptoms problematic. So there are specific symptoms related to that lowering of estrogen, so particularly in menopause, but it can be more appropriate in perimenopause as well, because as I mentioned, there are fluctuations in perimenopause, which can be more distressing. It can be a much more distressing phase because of that. So using MHT to increase and basically support the lowering of estrogen to improve symptoms can make a huge difference to quality of life and well-being. So for example, if there are lots of symptoms that are affecting that person's quality of life in daily functioning, so they're not sleeping and they have a lack of energy and they've got brain fog and lack of concentration at work, and then they're too tired to exercise and do anything else when they get home. They have difficulties with hot flushes and night sweats, or they might have anxiety and palpitations. All this has an impact on how they function in every aspect of their life. And if MHT can improve those symptoms and make that person feel better and able to function more in all the things that they are doing, I think that is a huge advantage that we can offer. There are lots of other reasons as well for MHT to be beneficial. For example, as I mentioned, bone health. This is quite important for women post-menopause. When we have a lowering of estrogen, we have an increased risk of loss of bone density. So our bones are more fragile and therefore at risk of osteoporosis. If we're replacing the estrogen then we are helping the bone strength and the bone health. So from a health point of view, this is hugely beneficial for a lot of women post-menopause. And as I said, cardiovascular health, if it started within the right time and it started appropriately for that person, it can actually help reduce the cardiovascular risk for that person as well. So there are not just personal well-being benefits, but there are also health benefits. But I have to say that it has to be appropriate for that person, because it may not be suitable, for example, if there are contraindications, such as someone's had hormone related breast cancer, for example. We need to have a further discussion about the risks associated. But if we're talking about a general population with no health issues, then it is hugely beneficial when, one, the lady is symptomatic, and two, it can help with bone and cardiovascular health.